Hey everybody, welcome back to another episode of Symmetrically Fit. I'm Dustin Gotro with Symmetry Personal Training. I've got Katy Girlinghouse with the Fit Pelvis in McKinney, Texas with me today. Real quick, Katy, before we start, I want you to share your contact information. If any of you guys are looking for a physical therapist, definitely give Katy a call. She's absolutely awesome. She works on me, she works on my clients, works on my dad. So anything you need to fix, give her a call. She'll take care of it. So how do they get a hold of you, Katy?
Yeah, so you can call or text me 214-600-8168, or you can send me an email, Katy, Katy, at thefitpelvis.com. Or you can go to our website, The Fit Pelvis, and reach me through there. But yeah, if you have questions, if you have concerns, if you want help, let me know.
All righty. So we're going to dive into the topic of tendons today, and we'll kind of touch on ligaments just a little bit to kind of differentiate. The reason we wanted to cover this, I think learning about tendon injuries can be really important because it's one of those things that can get to the point where you might be misinterpreting what's actually happening, and it may be at a point where you do need to get in and see a doctor, and you end up pushing yourself too far because you think it's just a muscle strain or something like that. So we kind of want to differentiate all of that. As always, guys, we're not diagnosing anybody. In fact, on this one, we're recommending if you suspect you may have a tendon injury, get to a doctor and get it checked out, get the diagnosis, and then give us a call and we'll figure out how to deal with it from there. But first of all, you need to know exactly what's going on. Is it a sprain? Is it a strain? Is it a tear, rupture, whatever it is? We need to find out. So you need to see a doctor. So once that's done, then we can help you guys figure out how to get back on the road to recovery from there. So, Katy, let's first touch on kind of educate people on what a tendon is, the function of tendons, and then just kind of differentiate a little bit between tendons and ligaments.
Yeah, so tendons and ligaments are both collagen structures, but a tendon attaches the muscle to bone, and ligaments attach bone to bone. So a little different function. With a ligament, there's no contractile tissue, so the ligament doesn't change length. When the bones move, muscle activation isn't going to change anything with that ligament. With a tendon, because it's attached to the muscle, there's going to be some stretch on it. There is some change with the muscle activation. So doing an exercise is going to be more painful with that. With our tendon, if we look at, well, did I answer all the questions? Sorry, I'm going to keep going.
No, keep going. That's all good stuff.
Okay. With a tendon, it's made up of collagen fibers, and normally they're all in a nice, neat row. So they like line up like that, right? So we have all of these fibers going in the same direction. But if we have a tear, some of those fibers are going to change direction, and they're going to look all scrambled if we look at them in imaging, and they're not going to make those nice, neat rows. When you have a tear, those ones that are scrambled, we call them disorganized fibers, they are never going to heal and look the way that the other fibers did. The tendons just don't do that. But the other fibers can adapt and become strong enough to make up for the disorganized fibers. So you might have half of your fibers working really well. They're in good direction. They're organized. They're strong. They're doing what they're supposed to be doing. And then you might have the other half that are disorganized, and you might never have any problems. You could be doing everything that you want to do with that.
Okay. I have a few questions, but I'm going to hold them until we get into more detail on that.
Okay.
Hopefully I'll remember them. So obviously, kind of getting into the actual tendon injury. So that's kind of where we're going to focus today is on tendons. We'll do another one possibly on ligaments later on in more detail. So with tendon injuries, there's so many different ways these types of injuries can present themselves, and it's difficult sometimes to decide is this just a muscle strain? Is it, am I just pulling on something, or is there a problem and I need to get checked out? So we want to kind of get into some details and see if we can help you guys kind of make that decision and be a little more aware of, hey, this might be a problem. I need to go have it checked out instead of taking a chance of further injuring it, especially based on what you just said, that once that tear happens and those fibers are misaligned and go in the wrong direction, they're not going to go back to normal. So even though we may be able to regain function, I would guess there's still going to be some effect, kind of residual effect of that tear being there, correct?
So actually, no. This is the crazy
Really?
thing. You would expect so. You would expect that maybe that tendon is weaker, more susceptible to an injury in the future, and it's not. It's not because we are able to adapt the other collagen fibers. They will completely make up for it, and it's fine. Now,
Okay.
ligaments, that's not true for. So we can talk about that later. But
Yeah.
yeah, with the tendon, you could go back to super high level activities, be totally fine.
Okay. One more question on that. Is that the same for the range of motion in the joint affected?
Yes. So it could be affected initially. It could not be affected. It doesn't have to be part of the symptoms that you experience. When you have healed and rehabbed that tendon appropriately, you should have full length.
Okay.
Yeah.
Very interesting. Okay. So in your industry in physical therapy, how common is it for you to see actual tendon injuries?
Yeah, so I would say because I'm in pelvic health, I don't see as much. If I was working with runners, if I was working with like people who participate in a lot of impact, so is it running, jumping, those kinds of sports tend to get tendon injuries more. That could also be like throwing sports for upper extremity. But because of who I work with, I don't see them that much. But they are common. I mean, they happen. Yeah. Do you see a lot?
I do actually. In fact, there's been a lot of situations where you know how I am, Katie. If it's something I'm not comfortable with 100%, I'm going to send them to somewhere, to somebody, just to be sure, to be on the safe side. And so I've had so many people come in with, maybe they sprained their ankle recently and they're still having all this pain and stinging and burning, and it's like, I can't see, without you go and get an MRI. I can't see what's going on in there, and so it's like, if there's a possibility of a tear or a partial tear, I can't really do that much. So yeah, I see quite a bit of it, and I'll typically kind of have to make that decision. Is this something that's healed all the way, or do we need to go have a scan done and just make sure that we're not going to cause any more damage
Mhm.
before we work on it. I would say the most common I see is ankle sprains. Ton of ankle sprains. I've seen some elbows. I've seen, um, I guess I would say, self-diagnosed tendonitis, which we'll get into some more detail with all that later. But yeah, a lot of elbows. Some knee stuff. I've seen some knees too. I
Mhm.
have worked with a few ACL tears after surgery.
Mhm.
Those are one of my favorite things to work with, actually. So yeah, I see quite a bit of it. So let's get into. We'll kind of explore more of the tendon injuries and exactly what that looks like, specifically. So starting with, I guess, the most well known out there, what most people know as tendonitis, which is essentially going to be inflammation in the tendon.
Mhm.
If you can, first of all, go over the newer terminology for that, just kind of educate people, and then some of the causes, and symptoms of tendonitis.
Yeah, so tendonitis is a like you said, it means inflammation in the tendon, and we don't use that term anymore as far as a symptom because the inflammation that is occurring in the tendon is not necessary for healing, and it is not the pain driver of their pain, right? So the inflammation is not the thing that's causing their pain, where in other conditions, inflammation could be causing their pain. That could be the main factor. So for tendons, it's not. And so we really say it's a tendinopathy. And basically that means is there's something wrong with the tendon because we don't completely understand what is driving the pain. We know that the tissue is disorganized. We know that there may be some inflammation, but it's not necessary. And we know that there are some like cellular chemical changes. And so that's where the research is at right now on like what are those chemical changes and is that causing the pain? And so we use tendinopathy to say there's a tendon problem.
Gotcha. So it sounds like a lot of, I guess, what we thought we knew about tendonitis is now we're finding out a bit unknown at this point.
Yes. Yeah, and that's I mean that's the way research goes. You learn a little bit more and you go, "Oh, that wasn't what I thought it was happening. What else is happening here and how does that change our paradigm as far as assessing and treatment?" Kind of like I was saying, if you have those disorganized fibers, they're always disorganized. So if you do imaging and you had Achilles pain 3 years ago, you healed that, it's still going to look dysfunctional, but you may not be having any symptoms. Well, I'm not going to go treat that because now I know that it's normal, right? Like
Right.
it may be perfectly healed. Um, Whereas before we may have been trying to treat that as the problem when there's really something else going on.
Right.
Um, yeah.
So
So I was the causes. You want to talk about that?
yeah, let's get into causes, and if you could touch a little bit on um, essentially if somebody comes in with inflammation in the tendon, what does that assessment look like? To I guess to kind of determine is this inflammation in the tendon or are we dealing with an actual strain or sprain or anything like that?
Yeah. So I would say, like, I'm not going to know if they have inflammation in the tendon, and I don't care really. If they come in and they have pain in the tendon, my assessment is going to look like one, I want to palpate and make sure that it's actually coming from the tendon and not something really close to the tendon. Because there are nerves that lay on top of some of the tendons, like the Achilles. The sural nerve lays right next to it. So you've got the Achilles is sitting here, and then you've got the sural nerve there. And sometimes it's the nerve, and so we want to make sure that we're treating the structure that is actually the problem, because that's going to look different with a tendon versus a muscle versus a nerve. Um, then the other thing I want to do is try to reproduce their symptoms, like what activities are producing it. Tendons don't like to be poked, so that doesn't always mean that that's the painful. Like if I poke your Achilles tendon, that may always be a little bit tender for you. But if I can load that tendon, so if I have you do jumping on one foot, or if we do step downs or step ups or something where the muscle and tendon have to work, and depending on the person, that may be a higher load. So I might have to do step ups with weight, or I might have to do jumping, and somebody else could just do like heel raises on a curb.
Okay.
Yeah, but it should be it should produce the pain with loading of that tendon. So getting that muscle to work.
Got it. All right. So I guess a lot of times there's this transition of you have inflammation in the tendon and we don't deal with it and then it starts to develop into other things. So I want to kind of go a little further into some of the other things. So first we'll look at strains, um, defined by tearing, twisting, pulling of the tendon. The difference in what's the main difference in a strain of the tendon or tendons, and just the tendinopathy?
So I would say like a strain that would just be like common language versus medical language. But they mean the same thing. So if you have a strain in your Achilles tendon or your patellar tendon, that is a tendinopathy. And basically you're saying that tendon is not able to work is not able to function at full capacity. So it may be painful. It may be partially torn. It may be have disorganized collagen fibers, but it is not able to work to full capacity.
Okay. So just to clarify, this is kind of for my own education too. If if you have a partial tear, medically that's going to be termed as a strain, correct?
It's going to be termed a tendinopathy.
Okay, they won't
So
even use strain.
no,
Okay.
no, you could say you have a partial tear and they'll grade it. But yeah, you could say a partial tear, but we wouldn't use the word strain.
It's still going to be tendinopathy.
Yep.
Something's wrong with the tendon.
Yep.
Okay.
Yeah.
All right. Very good. And then, so getting into this one, I've seen a lot more of, unfortunately, and it's an ugly one. Ruptured tendon, is that still the terminology for that situation?
Yeah. So you still have a tendon pathology, you still have tendon, but then you would say it's a full thickness tear.
Okay.
So partial thickness would be like part of the tendon is intact. We need to rehab that tendon. Full thickness tear, the tendon is no longer attached to the bone or the muscle, though more often it's from the bone. And so that muscle can't function at all. That tendon can't function at all because nothing is attaching it to the bone. So those need surgery.
Yeah. Yeah. I've seen a few of those, and it's not pretty at all.
Yeah, and those are, I would say those are really obvious.
Yeah.
Sorry, I'm beeping here. Because you get like, we call it like Popeye muscle, where the muscle just
Balls
like
up.
pulls back. So instead of like having a normal bicep, you'll have like a lump up here.
Yeah.
So they're really obvious, and then you can't use that muscle very well, that joint very well.
Yeah.
Usually people go to the doctor really fast for that.
Yeah. Yeah. So I would assume most ruptures are typically going to be the result of a lot of these other symptoms we've talked about leading up to it, or is it something you would typically just see randomly?
Randomly, that's what's crazy is like if you have pain in the tendon and you've already got some disorganized collagen fibers, you're more likely to adapt your activity. You're going to change. You're not going to be able to push off as much. Um, the when you get that full thickness tear, that full separation of the tendon, they usually just happen out of the blue. It's not going to be something where you um, have been having pain, having pain, having pain, having pain, and then all of a sudden you tear it.
Yeah. Yeah, I've seen multiple from bodybuilders. That's
Mm.
typically where I see it, and obviously there we're dealing with a lot of substances that shouldn't be in the body that are making them a lot stronger than they should be. And they just flat out put way too much load on a muscle that the tendon just doesn't hold.
Yeah, and I will say some of the supplements that people take are harmful to the tendon and they really do make them weaker.
Yeah,
Yeah. So, and then you're doing a very hard, high load activity with a quick motion. It's no different than jumping, right? It's
hmm,
just upper extremity. Um, and I mean, depending on what you're doing, upper extremity, lower extremity. But yeah, it's a quick, sudden burst of movement. And that's when tendons get pissed off.
yeah, very. Okay, so kind of starting to wrap up a little bit. The Again, there's so many different ways these types of injuries can present themselves. So, what are some ways that someone may be able to, I guess, be able to know this pain is coming from a tendon? What are like the common symptoms that you would see that people can recognize that they're having and say, "All right, this could be something. I need to have it checked out."
Yeah, so I would say you have kind of pinpoint tenderness. So it wouldn't be like your whole ankle, your whole knee. It would be like on the tendon. Um, it would also be like you can reproduce it with an activity. So I have a little cheat sheet chart. So like if it's the Achilles tendon with heel raises or jumping, hopping, with the hamstring, with you could reproduce it with bridges or a single leg deadlift, something that fully lengthens and loads that the hamstring and the tendon. Patellar tendon, that's going to be the same thing. Like it could be a lunge, it could be a what do we use? A single leg decline squat could be an indicator for that. Um, and so we have all these little like exercises that we use to test to see, all right, is this the tendon or is it something else? But you should have like kind of pinpoint tenderness on the tendon.
Okay. And then moving further, if just so people kind of have a picture of what would happen, let's say someone's dealing with this and thinks they have a tendon issue, they're going to the doctor. What should they expect? What are the doctors typically going to do um, to find out exactly what's going on? What are some of those?
Um, Depends on how up to date the doctor is. So we don't want to do corticosteroids because it feels better, but it can harm the tissue. So that's where knowing that, okay, so I want to be able to run. I have this tendon problem. If I go get corticosteroids, I'm going to be able to run, but I'm probably going to cause more damage. And like, do you want to keep running, or is this a like, let's get it healed for the next few weeks? Um, they could do some different injections as far as like platelet, PRP injections. Um, there's there's not great evidence on that. But those are a couple options. Honestly, the best thing for healing, unless you have a full thickness tear where you really need to go in and have surgery, is loading the tendon and getting the remaining fibers to work at their optimal function. And so we need to work on, like what we would do is work on isometric activity. So not give me a thumbs up. Not the um, work isometric. So we're having the muscle work without changing the motion. So not without moving the joint. So if we go back to our Achilles tendon, so instead of doing heel raises, it might be standing on the edge of a curb, and instead of letting your ankle come up and down, you're just holding that position. Right. So that decreases pain. So that's something we can use throughout the healing process, but that decreases pain and starts getting the tissue loaded without irritating it more. So then we'll go from isometrics to an isotonic movement. So we're going through the full range of motion. So doing that full heel raise. And then we want to start loading the tissue in a more lengthened position and a more explosive position. So we're going to add weight, and then we're going to add like jumping, hopping sort of activities.
Okay. So you talked a little bit about, I guess the progression of starting with isometrics and then moving on. When it comes to concentric and eccentric, is there more or less benefit from either one of those at any point in that process?
No, this is another thing that there's newer research out saying that um, it's not all about eccentrics. We need to be able to move through that whole motion. And it's funny, we were learning about this. The study where they came back and said eccentrics are really helpful was a very, very specific patient population that does not fit it doesn't fit everyone, right?
Mm.
It was basically like middle-aged men who were like weekend warriors. They needed eccentrics, and it was helpful for them because that's where their tissue needed to be loaded. The isometrics were easy enough, they could do that, but they couldn't do the jumping, hopping. And so for them, that's where they needed to be. But really, what we should do is take everyone through that whole process. People might move through the isometrics really quickly and be in concentrics and eccentrics for a long time, or they might move through that quickly and they really need the loading with weight, or they really need the jumping, hopping. But we want everyone to move through all of those stages.
Awesome. We'll do, side note, I want to do an episode on the types of muscle activation and muscle action,
Mm-hmm.
to kind of educate people a little more on what we mean when we say concentric, eccentric, all that stuff. Um, just so people have a little better idea. I think sometimes we use all this terminology and it's familiar to us and people have no clue what we're talking about. Um, I see that a lot with my clients. I'll say something and they're just looking off into space. They have no clue what I said. So let's do an episode on that soon because I think with a lot of the topics we cover, it's important for people to understand muscle action and some more details on that. So
Yeah, absolutely.
all right. Well, pretty quick one today. Again, guys, if you suspect any type of tendon injury, if you have any of the symptoms that we talked about today, see a doctor as soon as possible, get a diagnosis, see what's going on, and then feel free to reach out to us and we can start looking at your recovery program from there. I'll leave all of our contact info in the description. And we will be next week. We're going to be covering an interesting topic. We're gonna talk a little bit about, I guess, psychology, really. The idea of patience and how stress affects our actual health. I have a lot of experience with learning about that, unfortunately. So I want to get on here and kind of share some of that and see if we can get some of you guys to slow down and de-stress a little bit and live a little bit happier, healthier life. So that's for you too, Katie.
Yep, yep.
Yeah, a little bit for all of us, I guess. All right. Well, we'll see you guys next week. Y'all have a great week and have a great fourth. By the way, me and my family will be out at the Red, White, and Boom in McKinney. If anybody wants to come out and find us, we'll be out there from about 5 p.m. to 10 p.m. Katie, are y'all doing any fireworks shows?
No, my in-laws are taking the kids for the weekend, last
Ah,
minute surprise, so I'm thrilled for that. We are going to go to the parade downtown McKinney though. So if anybody wants to chat with me there, I'll be out there.
all right. That's where we'll be. For us, it's tomorrow. When you guys see this, it'll probably be the day of. So come out and find us. All right, everybody, have a great week. We'll see y'all next week.